Good afternoon, everybody. I'm Sanyukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch intensely. It may be due to the chemicals present in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the causes even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early relief. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of tests required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, we have with us renowned dermatologist of India, Dr. Gunjan Gupta, live from Skin Concepts Clinic Noida. She will educate us more about urticaria and its management. Dr. Gunjan Gupta is a dermatologist in Noida, a very senior dermatologist, and has an experience of 20 years in this field. Dr. Gunjan Gupta, senior consultant at Skin Concepts in Noida and consultant dermatologist at HCL Healthcare in Noida. She completed her MBBS from Medical College Baroda in 1997 and DDT from Medical College Baroda in 2000. A very warm welcome to you, Dr. Gupta. It's a pleasure to have you with us.
Thank you. Thank you.
Dr. Gupta, today we are talking about urticaria, a skin condition that many people are not aware of, but it's very common. So the whole purpose of having this session is to spread awareness about urticaria and its management. Now, to begin with, I would first like to understand what urticaria is.
So urticaria, as you mentioned earlier, is a condition where you get swellings all over the skin. They can happen anywhere from the head to toe. You have red swellings. They seem like mosquito bites. They can be either skin colored or red. They might feel warm to touch. The size can vary from a few to very large, map-like lesions. When a lot of urticaria regions, merge together, they can form geographic patterns all over the body, and it can appear very scary to look at. So you can have rashes from anywhere from face to toe, and these rashes can generally last less than 24 hours. So it can last from a few minutes to a few hours. It can change sides, it can resolve at one side and then reappear again at another side. So these are generally the clinical features of urticaria. In case it is associated with a deeper swelling also, which is known as angioedema, you might have swelling around your eyes, the soft tissue of the eyes, your lips, your hands and feet might also get swollen. So these are some of the clinical features of urticaria.
Okay, so this is what
generally
urticaria.
आम भाषा में उसे पित्त बोलते हैं, पित्त उछलना बोलते हैं. So it's generally commonly recognized by everybody, and it's actually colloquial language, it's known as pitt uchalna.
Okay, fair enough. And talking about the main causes of urticaria, hota kyun hai urticaria? What are the main causes?
So urticaria can be allergic. It can be non-allergic causes also. So generally, बच्चों में ज़्यादा common है because of infections. Infections can be anything from viral to bacterial to parasitic infections. It can be because of certain drug reactions. In adults also, again, infection remains one of the main causes. Any focus of infection in the body, be a stomach infection, urinary tract infection, a tooth infection, a viral, in fact, lately COVID infections. So any kind of infection, a drug reaction, it could be an allergic reaction to the animal dander, plant pollen, or it could be, because long-term urticarias have other reasons, like physical urticarias can be because of change in temperature. Extremes of temperature could trigger urticaria. It could be heat, it could be cold, it could be deep pressure, vibration, or even sweat urticaria. You have, which is known as cholinergic urticaria. You have solar urticaria. You have aquagenic urticaria, which is triggered by water. So there can be numerous causes of urticaria. So mainly it's
Exactly.
infections, ingestion. Food items again are a cause of they're not as common as the common belief is, but yes, food items could also trigger urticaria.
Okay, so there are a number of things that
As you
can
mentioned
cause.
earlier, in many cases, in fact, 20 to 40% of the cases, there is no identifiable cause, and they're ultimately labeled as chronic idiopathic urticaria. Basically, it's because of autoimmunity.
Okay. So now we at least know that there can be n number of reasons or causes behind urticaria, or at
So
times
when you
the
meet your
reason is
doctor,
unknown.
you give a detailed history. We try to find out what has been the, in the last few hours or days, what has been, what could be the likely trigger of urticaria. So at times we are able to identify a cause. Many a times there is no identifiable cause, and the urticaria persists for several weeks, and then that's it when it's labeled as autoimmune urticaria.
One more thing, doctor, that we would like to understand is it an allergy?
As I mentioned earlier, there are allergic causes also, as well as non-allergic causes also. So allergic causes,
Mhm.
as I mentioned earlier, it could be infection, infestation, it could be inhalation because of animal, plant, and plant pollen, animal dander, etc. Drug allergy, food item allergy, or it could be non-allergic reasons also, like
Mhm.
autoimmunity. Or it could be physical urticarias like heat, cold, temperature changes, pressure, water, etc.
Right.
So
You have
some of the
already
causes of urticaria are allergic and some urticarias are non-allergic in nature.
Okay, doctor, you have also mentioned that how it looks like, but for our viewers, I would request you once more to, let us know how does urticaria look like? कैसा दिखता है, कैसा होता
Suddenly start, itching severely all over the body. You have mosquito bite like swellings, randomly anywhere on the body. It could be red or skin colored. They feel warm to touch. These are generally, and if you have swelling over your eyes or your mouth or your hands and feet, at times, severe angioedema, that's the swelling of the deeper tissues. It can also be associated with gastrointestinal symptoms like stomach ache or vomiting, um, swelling in the pharynx or the deeper tissues of the mouth could lead to discomfort in breathing. Very rarely, acute urticaria could be a part of a severe allergic reaction known as anaphylaxis. That is when you have systemic symptoms like, hypertension, because of which you would feel dizzy. There could be loss of consciousness, this low BP, respiratory discomfort, severe difficulty in breathing. So that's an emergency. That's generally a separate entity which we'll not be focusing on today. At times, urticaria is part of that angioedema, but most of the time, urticaria is a non-serious condition where you are uncomfortable, but it's not life-threatening.
So as you have mentioned that urticaria is most of the time non-serious condition, not very serious, but
Non-life-threatening, I would suggest, but in the sense, it does affect your quality of life. You feel itchy all the time. You're uncomfortable. You're not able to focus. You're not able to sleep. So it does affect your lifestyle and quality of life.
definitely a lot of frustration, discomfort, irritation due to all the itching, etc. Doctor, there are two types of urticaria, chronic and acute and chronic, I should say.
Yes.
So, what are chronic and acute urticaria? And
Urticaria is generally, the duration of urticaria has been 4 to 6 weeks. It's labeled as acute urticaria. Acute urticaria is separately identified because normally such cases are, the reasons are slightly different. It's generally self-limiting. But when the urticaria persists beyond 6 weeks, that is when the causes are likely to be different. And any urticaria which is lasting for more than 6 to 8 weeks is labeled as chronic.
okay, and how will they go away, the chronic urticaria?
So the management of urticaria will depend upon the reasons, underlying reasons. Acute urticaria, the management will be different. The chronic urticaria, slightly different in the sense that acute urticaria doesn't require too much of investigation because generally self-limiting, there has been a bout of fever or a viral infection or sore throat or something in the child, and there is a bout of urticaria triggered after that. So it is generally self-limiting, should go within 4 weeks. So we don't investigate too much when it's acute urticaria, so that the duration, whenever the duration of urticaria has been short, 2 weeks or 3 weeks, we don't do too many lab tests. We just give antihistamines, and that is anti-allergic medicines, oral medication, and that should settle it. But when it's been a chronic urticaria, it's been there for several weeks now, and it's not going away. It's not settling by the routine over-the-counter available anti-allergics. That is when we tend to investigate a little. At least we run basic tests to rule out any focus of infection in the body. We try to do the thyroid antibodies, serum Ig levels, CRP levels to find out some basic trigger cause or something to give a clue to the underlying reason for urticaria. But we may not be successful. Most of the times the reports come out to be normal, and it's at times difficult to find out the identifiable cause of urticaria.
So it's more important to diagnose the cause and then the treatment is, set.
And as far as the patients are concerned, when you're at home and at a certain odd hour you start developing itching and an acute bout of urticaria, what you can do at home to relieve the itch is use a cold towel over the area. You take a cold shower, use a gentle cleanser. Don't rub your skin with the towel, just pat dry. Wear loose cotton clothing. There are certain there's several in fact anti-itch lotions available. They generally contain calamine or menthol, or you have a pramoxine-based lotions also, which relieve the burning and itching of urticaria. You could apply those anti-itch lotions and take an over-the-counter available anti-allergic tablet. These are the things that you can do at home. Try not to scratch too much. The more you itch, the more worse it becomes. So these are some of the things that you can do at home to relieve the itch. And you don't need to apply too much. It's just a cold towel suffices. You don't need too much of medicines to apply, right? And once in case it hasn't settled in some days also, that is when you see your doctor.
Okay. And as you have already said that it's not a very serious condition most of the time, but are there any potential complications of urticaria if left untreated?
Okay, so as I mentioned earlier, urticaria, or especially chronic urticaria, it's generally a question of quality of life. You're not able to concentrate on your work. You're constantly itchy and uncomfortable. You're not able to sleep properly. That affects your productivity. So in general, it's more of a niggling problem. Only very rarely urticaria is when when it's part of a severe allergic reaction like angioedema. Only that is the time when it is dangerous. Otherwise, it's more of a chronic problem which is affecting your lifestyle, and you need to address it.
I can understand by what you're saying, doctor, that urticaria do cause a lot of stress, definitely, because it's come with a lot of discomfort, frustration, irritation. But can urticaria be caused by stress?
Yes, it works both ways. Urticaria itself can be a reason of a lot of stress. When you're constantly uncomfortable for several weeks and months together, it can really be a stressful condition for you because you're not able to concentrate at work or in school. And vice versa, if you are under any kind of stress, it will trigger your urticaria. So any long-standing skin problem is generally psychogenic factors do have a role. So it could the stress itself could precipitate urticaria.
Okay, so it's like a vicious circle, stress can lead to urticaria, urticaria can lead to stress. We would also like to know, doctor, many a times patients complain that their urticaria get worse during night. Is it true?
Not really. Urticaria can happen any time of the day. There are, maybe at times, when you're busy throughout the day, you tend to ignore it. But then at night, when you're about to go to sleep and you want to relax, that's the time you feel, uncomfortable, and it bothers you a lot more. But there is no particular, time for urticaria. It can happen anytime during the day.
Maybe, yeah, because we are preoccupied during the day with work, etc. So maybe during night it bothers us more. And doctor, does urticaria make a person tired?
Obviously, if you're not able to, sleep properly because of the constant itching, it's bound to make you feel tired all the time.
Mhm. Now, initially, you also mentioned as one of the causes that allergy to certain food items is also one of can be one of the causes of urticaria. Now, in that case, is there any dietary precautions or do's and don'ts for patients of urticaria?
Yes, in the sense if you have any known triggers for food allergies, some people are allergic to eggs or nuts or Chinese or seafood or something like that, you obviously need to avoid it. Other than that, even in other cases of urticaria, we generally ask them not to eat foods that have food preservatives, packed foods, food additives, coloring agents. So because these are known as pseudo allergens, which can trigger, which can worsen any other kind of urticaria also. So we generally tend to ask the patients to avoid preserved and packaged foods, at least for a period of 3 to 4 weeks.
Hmm. So this is for those who have allergy or who are having urticaria because of allergy to certain food or food
No,
items, right?
that's what I'm saying. One is you are allergic, have a known allergy to a certain food item. You obviously
Right.
are going to avoid that. But even other than that, in all urticaria patients, especially chronic urticaria patients, we advise them to stay away from packaged and color food with food additives like coloring agents and stuff. And try to
Okay.
eat fresh food as much as possible.
Mhm. Agreed.
There are certain fruits which are rich in histamine, like strawberries. In fact, tomatoes are also rich in histamine. So generally, if it's a chronic severe urticaria, we might ask them to, withhold for a while. But other
Okay.
than that, not much dietary restrictions.
Fair enough. And with the normally with skin allergies, people have this notion in their mind that they'll get it from another. It's contagious. What's the case
No,
with urticaria?
urticaria is absolutely non-contagious. It is your immune system which is overreacting to the environment,
Mhm.
overreacting to things which are not causing any problems in the rest of the people around you. So it is there's some trigger in your immune system which is making it react, but you cannot transfer that to another person. It is not an infection, so it's definitely not contagious.
Okay. And initially, when you were elaborating on the causes of urticaria, you also mentioned COVID or Corona. Now, after Corona, many patients came and said that they have these hives on their faces. COVID has caused hives on their faces. How true is
Uh,
that?
Corona, in fact, urticaria could be the presenting or the starting symptom of COVID. At times
Okay.
patients present with urticaria and gradually over the next few days they develop fever, low-grade fever or something. So especially in the last few months, urticaria has been the presenting symptom of COVID.
Mhm.
And even otherwise, post-COVID or any kind of viral infection can trigger urticaria. Vaccination itself also can trigger urticaria. So at times people develop urticaria post vaccination, but then it is not a contraindication for vaccine. In case even after the first dose, if you've had urticaria, you need to go in for the second dose because urticaria can be managed with the anti-allergic medicines. It's more important to get vaccinated.
Okay. And you have said that we don't normally do lab tests, etc., to diagnose these, especially
No,
in case of acute.
what I told you was we don't do lab tests in the first few weeks, couple
Right.
of weeks, first two,
Yeah.
3 weeks.
For acute urticaria.
Only if the urticaria continues, it's persistent, that is when we might run a few lab tests.
Okay. And what lab tests are then needed?
Simple, blood counts, serum Ig levels, thyroid autoantibodies, C-reactive protein. You might get your urine and stool routine micro also done to rule out any infestations, any infection, focus of infection in the urine. That's other than that, will depend upon the history. If we are suspecting some, in chronic urticaria, at times it's associated with some underlying autoimmune conditions or connective tissue disorders. Only, if the patient has some other symptoms or history, accordingly we need to choose the investigation, but that's not very common.
Okay. And we would also like to talk about the treatment options available for urticaria.
So for acute urticaria, most of the times a simple antihistamine or an anti-allergic tablet suffices. Most commonly used are the second or the third generation antihistamines. these second or third generation histamines are not sedative, so they don't impair your psychomotor functions. And they don't cause other side effects like urinary retention or dryness of mouth or cardiac arrhythmias and things like that. So the second generation antihistamines like loratadine, you have cetirizine, levocetirizine, uh, several others. The third generation are metabolites of the second generation like fexofenadine. Then you have bilastine. So there are several molecules available, and you could take any one of these for a few weeks to settle the urticaria, and generally that suffices. Only in very severe cases, the second line would be to updose the first drug that you've been given. So at times, in adults, we might need to double up the dose of the anti-allergic that has been given. In fact, the dose can go up to 3 to 4 times in the initial few days to settle the urticaria. Now, second scenario is even after updosing, it hasn't settled. That's the time when, in case of acute urticaria, a very short course of steroid under medical supervision, obviously, after ruling out any underlying infection and things like that. And because if there is a parasitic infection, worms in stool or something, we tend to treat that first, and the urticaria will automatically respond. So once we ruled out the trigger or we found out the trigger, we try to remove that. So avoiding the trigger is, of course, one of the mainstay of the acute urticaria treatment. Apart from that, antihistamines, updosed antihistamines, if not responding to that, that is the time that we resort to a short course of steroids, low dose, short course of steroids.
Many times, doctor, happens. Yes. Many times it happens that
in chronic urticaria.
Yes. I was saying that many times it happens that a patient, especially in the case of chronic urticaria, for example, is going through a treatment. Now, instant relief जैसे ही मिलता है, उनको लगता है कि ठीक है, हो गया, अब मुझे दवाई बंद कर देनी चाहिए. वो बंद कर देते हैं. फिर उनको symptoms हुए, तो फिर उन्होंने prescriptions.
This is possible in acute urticaria. You take a medicine for a few days. As soon as you relieve, you can afford to stop the treatment.
Right.
But in chronic urticaria, normally, it's been there for several months. You will need to take medicines for at least a few weeks, at times to suppress the urticaria. And even then, it might not. So there is no particular duration up to which you might need to continue the medication. It can persist for months together. Average duration is in fact 2 years, and even at times beyond that. So, then a chronic urticaria, it will all depend on the reason also. If it's some physical urticaria, because of the cold, you need to dress appropriately, avoid cold exposure. If it's because of the solar urticaria, you need to, apply a sunscreen and avoid sun. If it's because of heat or something, you need to avoid extremes of temperature. If it's because of, friction, you need to, be careful to avoid tight clothing. If you're wearing a bag, you need to wear broad straps so that the surface area is widened. So depending upon the trigger, you need to address that. Other than that, you have chronic idiopathic urticaria or autoimmune urticaria where there is no obvious cause. In that case, you need to continue medication for several months to suppress the urticaria, and it will all depend upon the severity and the response. If it doesn't respond to just regular medication like antihistamines, we might need to step up the treatment and go on to higher drugs like cyclosporin or others like even immunoclonal antibodies like omalizumab.
Right. So it's important to trust your doctor. It's important to complete the course of treatment, and it's also important to understand what triggers urticaria for an individual and to address that. And only a doctor, a specialized doctor, dermatologist in this case, can help you out. So please go and consult your dermatologist if you see any signs of urticaria.
Exactly. So I would like to say that yes, I understand in the first few days, especially if you're out of station or you're not in a position to see the doctor, you could take an anti-allergic for the first few days. But in case the lesions persist, in case they are associated with swelling of the soft tissues, like, the swelling of eyes or lips or hands and feet, in case there is any associated systemic symptoms like vomiting or stomach ache or fever, or the urticaria is not going even after a couple of weeks of routine medication, that is the time you need to stop self-medication and start seeing a doctor.
Exactly. We'll pick a few of our viewers' questions, Doctor. Saloni Singh is here asking, antihistamines have stopped working to control my symptoms. What are my other options?
So will depend on what dose you've taken, how long you've taken, which one you have taken. At times, we give one antihistamine, and as I told you, we updose it even up to 3 to 4 times. At times, we add on a sedative antihistamine at bedtime so that the patient is able to get his or her quota of sleep. If 2 or 3 different kinds of antihistamines are not working, um, options are depending on your trigger or whatever. It has been ruled out, infection or infestation has been ruled out. There is, all your blood tests are clear. That will depend. And then you might be given higher drugs like cyclosporin or others,
Right. Palak Dubey is here, Doctor, asking, is urticaria genetic?
Certain chronic urticarias could be genetic, physical urticaria especially, but not otherwise.
Okay. Ishita Jha is asking, though we have discussed.
Allergic tendencies run in the family, it OB. So at times you might, be prone to urticaria, chronic urticaria, but not always.
Okay. So in case, for example, my any of my parent is allergic or they have the history of urticaria, then what should I do, even if I have not yet seen any symptoms of
Not
it?
that direct a relationship. It's not necessarily that in case your parents is having urticaria, you're bound to get urticaria.
Okay. Ishita Jha is asking, doctor, that what laboratory tests are needed for simple chronic urticaria, no fever, arthritis, and
Okay.
else?
Simple, blood counts, thyroid antibodies, serum IG, CRP, urine routine, stool routine. Rule out some focus of infection in the body to know the status of your IG immunoglobulin. That's it. At times CRP is elevated in chronic autoimmune urticaria, so that is important.
Okay. Dr. Tripti Pandey is asking, what steps can I take to prevent getting hives or swelling in the future?
Will depend in whether you have been able to identify a cause or not. Obviously, you need to avoid all known triggers in case you're allergic to certain medication, you're allergic to certain food item. And in general, in most urticaria patients, we ask them to avoid all unessential medicines because medicine allergy is one of the most common causes of urticaria, and especially medicines like painkillers. Painkillers are also, known to worsen all other kinds. One is you're allergic to certain painkiller and you've taken the painkiller and the urticaria is because of that. And the second is urticaria is because of some other reason, but your painkillers, especially, NSAIDs or Disprin or aspirin, Brufen, Combiflam. So these are the combinations which will worsen your existing urticaria. So you need to avoid all kinds of painkillers. Paracetamol generally is safe. And other than that, you need to avoid all kinds of, even homeopathic and Ayurvedic medicines, but because you don't know what is triggering your urticaria. So in general, you need to avoid all unnecessary medication. Even supplements, we need to stop for a while because you could be, allergic to the food, the color or the capsule, the material
The
of the
coating or, whatever
coating or
is.
whatever. So we stop all unnecessary medication,
Okay,
unessential medication.
right. Priya Sharma is here asking, what should be the focus of the physical exam for urticaria?
Urticaria is actually pretty obvious clinically. You have those hives, and even if they're not present when you're visiting your doctor, your history would give you doctor a clue as to the diagnosis. So
Mhm.
physical examination is not much, of a problem in urticaria. You could be having, swellings anywhere in the body. You could be having soft tissue swellings on your face or your lips, eyes or your lips or hands and feet. What we need to rule out is that the urticaria lesion and the individual urticaria lesion, if it's an ordinary urticaria, it should not last for more than 24 hours. If your urticaria is at a particular site, one is it comes and it's gone and then it's come back again. That's different. But an individual lesion lasting for more than 24 hours will need to be investigated separate in a different mode because that indicates probably underlying vasculitis or something, or different reasons. We'll have to rule out connective tissue disorders and things like that. So as long as the urticaria lesion is not lasting for more than 24 hours, it is fine.
Okay, doctor, what are the common mistakes that patient with urticaria, commit and they end up making the condition worse? What are the common things that they do?
One, self-medication is very common in our country, using a lot of Ayurvedic and homeopathic preparation, assuming that since they're natural, they are not bound to cause any issues. You could be allergic to anything. You could be allergic to some medicine that you've been taking for long also. Then painkiller popping is quite common. Popping a Disprin, they even forget to tell your doctor that you popped painkillers in the last 1 week or something. So that is one thing that I'd like to mention, that stop all unnecessary medication. And then food, again, you need to stop eating outside food which has colors and additives and things like that. Stick to a fresh food diet. Other than that, you need to avoid, tight clothing, synthetic clothing. You don't need too much of topical medication, except for, as I told you, a simple anti-itch lotions which have calamine or a Bromoxin to soothe the lesions in case it's very severe. Otherwise, a cold towel would suffice. You don't need you to rub, a lot of ointments, because it's the anti-allergic oral medication which will reduce your urticaria, not something which will apply on your skin. Ice is more than enough. You don't need to apply anything else on the surface. You don't need ointments and creams to apply on the surface. Just trim your nails so that you don't scratch and end up having marks. That's about it.
Okay, one more thing people do more often is apply aloe vera or things which are easily available at their home. I mean, you have already mentioned that ice is sufficient,
Yeah,
or a
if
calamine
give
based
you a
lotion.
cooling sensation, you're okay with it, fine.
And as we are moving towards the conclusion part of this session, what are the important things that you would like to share with our viewers?
As I mentioned earlier, you should know when to visit your doctor. A few days of self-medication is fine, but if in case your urticaria persists, you need to see your doctor. You need to go to a hospital for immediate attention in case you're feeling any respiratory discomfort. If there is swelling in your pharynx or the internal tissues, so that indicates severe angioedema. That's the time you will need to visit the emergency of a hospital, or probably an injectable. Other than that, whenever his urticaria is persistent, associated with any severe symptoms, you need to stop all unessential medicines and visit your doctor.
Yes. Thank you so very much, Dr. Gunjan Gupta, for your valuable time, ma'am. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, at least they now know that instead of self-medication, it's always better to approach a nearby dermatologist. It was great to hear you, and we really look forward for many more such sessions in coming times with you for our viewers. Thank you so very much.
Thank you.
We would also like to thank our viewers for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Bye-bye.